alpha-1 antitrypsin deficiency. AAT deficiency is not rare but is severely underdiagnosed. According to the Irish Thoracic Society, there are over 2,000 people who suffer with severe AAT deficiency, while over 200,000 people are carriers here in Ireland. Unfortunately, Ireland actually has one of the highest rates of alpha-1 antitrypsin deficiency in the world. So what actually is it?
It's a protease inhibitor belonging to the serpin family. Its mechanism of inhibition is much like a mousetrap. The protease attacks the reactive center loop of the AAT molecule, with the active serine of the protease forming a link to the amino acid at the base of the reactive center. The cleaving of the reactive loop allows it to snap back into the main B sheet of the AAT molecule. This spring-like movement flings the tethered protease to the opposite end of the AAT molecule, distorting its active site and altering its structure so that it can be destroyed. In alpha-1 antitrypsin deficiency, the AAT molecule can't make it to the lungs as it is misshapen. So what happens when AAT is not carrying out its proper function?
People with the symptoms are almost never diagnosed with alpha-1 antitrypsin deficiency and are instead diagnosed with other lung diseases such as asthma. That's if they are diagnosed at all before the deficiency develops into something else. Although alpha-1 antitrypsin deficiency is inherited, meaning the person affected has the deficiency from birth, the first signs of symptoms don't usually develop until between the ages 20 and 50. However, in other cases, children suffer with early onset emphysema and liver disease as a result of the deficiency. The first symptoms that you would notice include things simple as shortness of breath, following mild activity, and a reduced ability to exercise. The general symptoms for this deficiency include wheezing, unintentional weight loss, recurring respiratory infections, fatigue, rapid heartbeat upon standing.
The progression of AAT deficiency includes the worsening of the previously mentioned symptoms, along with the development of lung disease such as emphysema or COPD and liver disease, which ultimately leads to liver fibrosis. As previously mentioned, the normal AAT protein molecule is made in the liver. However, in those suffering with the deficiency, the abnormal AAT essentially gets stuck in the liver due to its incorrect shape. In these cases, most of the AAT doesn't leave the liver, causing damage to the liver itself and to the lungs, where the protein would usually carry out its function.
The lungs appear to be the organ most affected by AAT deficiency. Those who suffer from chronic obstructive pulmonary disease as a result of AAT deficiency usually show symptoms in their 30s and 40s, while those without the deficiency usually show symptoms in their 60s and 70s, even in cases of smokers.
Emphysema is commonly linked with AAT deficiency. There unfortunately is no cure for the disease. However, there are some treatments to make life easier for those dealing with the disease, such as taking of inhaled bronchodilators and inhaled steroids. These medicines open up the airways and make breathing easier. Extra oxygen may also be needed, or in extreme cases, a lung transplant.